just summing up Crohn's Colitis today, it's a membership organisation, it provides information and support, it campaigns, raises funds, can give personal grants, works with health professionals, and it does fund some research. So that's a word from my sponsors, as it were. Moving on to the IBD patient in the new NHS. What I'm going to say is just a personal opinion about how I think some of the things might change, some things might develop. And I would say that having listened to the video on the Ibd service that's offered here in South Manchester, I'm aware that this hospital is very much leading the way, and some of the suggestions that I'm making or might suggest have already been implemented at this hospital. I think you've got a really very good service, and I hear that from other people who I've heard talking about it as well. What are the key themes in the NHS? What's changing at the moment? The themes, the bullet points that I've put down, I think apply regardless of who the health secretary is, whether it's the change from Andrew Lansley to Jeremy Hunt, or whether it's a change from a government from Labour to Conservative or back again. I think there's a direction that is common to all, and I think those themes, as far as the patient is concerned, are around choice. You'll have more choice about where you go, and more options will be explained to you about how your treatment might be developed. Particularly integrated services across the health service and social care, but also integrated services between the hospital care and your GP. And I'll come back to some of these themes in a minute in greater detail. I think patients will have a greater say in how service is designed, their local service is designed, and there will be an emphasis on quality and the importance of the patient experience. So I think those are non-political themes, but it's the direction in which the NHS is heading at the moment. So I've divided the talk into two bits. One bit is about the IBD service, and the next bit is about the patient experience. So first, how is the IBD service developing? All too often when I travel around the United Kingdom, I'm told that, there's a gap between primary care and secondary care, particularly where IBD patients are concerned. Many GPs are quite happy for the care to take place at the local hospital, and are quite happy to refer their patients straight into that service. But there are sometimes financial impediments that prevent an integration between primary and secondary care. And with the direction of close to home, I think GPs will become more involved in the way that IBD patients are looked after. There's no reason, for example, why an annual review couldn't take place at your local GP surgery if it is provided with the support from the local hospital. To help this, there should be a shared electronic record of the current care plan for staff that's accessible between the hospital and the GP. Another theme that I think will develop in the next few years is there'll be a great emphasis on self-management. Not everybody wants that. Some people do, and some people would run away from it. But for those that do, they need to know within what parameters they can self-manage their condition. And this is when they need to have ready access to their local IBD service so that they can get advice and information. That might be email access, it might be text access, it might be telephone access, or it might be dropping in for advice. So that patients are able to monitor their condition and seek help when they're not quite sure how far their self-management should go. All patients who have been diagnosed with IBD, whether it's ulcerative colitis or Crohn's, should have an annual review, and this could take place by telephone or by email, or by attending the hospital or attending the GP practice. At the moment, many patients will have an annual review, but there are some, or indeed quite a lot, that perhaps have not had a flare-up recently and are not therefore on the radar for being called in for the review. One of the problems around IBD is that there's a lack of information. There's not a national database, and many hospitals do not have a local database of the patients with IBD. This presents problems when trying to develop the case for service development and more resources, because the information is frequently not there compared with some other conditions. So in the future, I think we'll see a development of IBD databases both locally and nationally. There should be an IBD patient panel. There is one here at this hospital. This is groups of patients who work alongside the professionals to talk about service development, service improvement, and they offer their experience and their ideas on how the service could develop in the future. And like today, I think every hospital should have at least one meeting annually based on IBD, where the IBD department come and say, this is us, this is the service, come and meet us, we'll have stalls, meet other people. I think they're great events. So moving on to the patient experience now, and a little bit away from the IBD service, what should the IBD patient experience in the new NHS? Mark trumped me on this one. The patient should have access to an IBD service description leaflet. Not only does this hospital have an IBD service leaflet, it also has an IBD service video, which you've just seen. So, and I think that's the first in the country as far as I know. The patient should also have information around what the service does, times of referral. I talked about choice being one of the key themes in the NHS. To make choice, patients need information, and this is not yet fully readily available in a more detailed sense in different departments, so that patients can decide which hospital they might want to go to, as well as what sort of treatment they would choose to go, which line they would prefer to go down. I think a key moment for many patients is their diagnosis and the opportunity to talk through the implications of their disease. And I would like patients to have a separate session with perhaps half an hour, maybe more, to talk through some of the implications of their condition. Consultations could include a means for patients to define their issues. There's been a recent survey that says that 53% of patients said that they were not able to tell their doctor something that was important to them. And that's perhaps because they feel they don't have enough time, or perhaps they don't feel that it's the right moment to raise it. When patients have an annual review, I'd like to see it have a more holistic approach to living with IBD. I'm not saying it's not a criticism of this hospital, but in many places the focus is on the clinical condition of the patient, whether there's been a flare-up or not. But there are also issues around living with IBD, including psychological well-being, which are very important. And so I'd like an annual review to have the opportunity to discuss some of those issues, and including choices of management of the disease and whether or not patients are taking the medication that they've been prescribed. And plus the opportunity for the patient to talk about living with IBD issues and their experience of the service. So the review would essentially have a clinical well-being element, but within a patient-directed consultation. I won't go into details on this slide, but there are two ways. This is a diagram of patient involvement in the commissioning cycle. And I think patients can get more involved in the commissioners, that's the local commissioning groups that are being set up at the moment, who purchase a service for patients. And they should be able to influence and talk to those commissioners about what priorities are and what the strategy should be for the development of their service. But specifically, I think patients and carers can be engaged. That's the slide on the, where are we? On your right, patient and care engagement to improve services, and that's things like patient panels. And days like today when there's opportunities for feedback, and on the left the patient and carer engagement to monitor services. There's currently talk about patient-led inspections, so that you can go around the hospitals and the wards and provide your comments on what you think they look like. Are there enough toilets for patients, for example, on the gastroenterology ward? Looking a little bit beyond 2017, that's sort of, 4 or 5 years hence, I've been talking perhaps in the shorter term, I think that a lot of patients that I talk to often wish to explore complementary management approaches to managing their condition. And perhaps an IBD service could offer patients a list of approved local therapists who they know and who have committed to a safe approach that does not undermine the patient's confidence in the medical management of their condition. Again, this is very much my own personal views. I'm not speaking either on behalf of Crohn's Colitis UK or anyone else. Beyond 2017, on patient choice, I think patients should be able to have access to an annual review of their department's service so they can see their hospital's performance compared to national benchmarks and perhaps other hospitals' performances, and then make choices about where they want to be treated. I think this will happen. The IBD service, this is a little bit more off the wall perhaps, but being a patient involvement lead or development worker, this is the sort of thing that I would say, that an IBD service might have a managing board that includes a number of patients, a bit like a school governing body, responsible for reviewing the audit data, service developments, and requests to manage service change. How about patients attending their multidisciplinary team meetings to discuss their current condition? At the moment, as far as I know, that doesn't happen, but perhaps a patient does have something to input onto those discussions. I say it doesn't happen. It certainly happens in the mental health sector. If there's a multidisciplinary team meeting taking place about someone with a mental health problem, they will attend. And this is my final slide, I think. That is that the patient and professional relationship will be a respectful and collaborative one that sees consistent patient engagement as an integral part of the normal way of working. So those are a few of my thoughts on the patient experience, and if you have any questions or any comments to make, I'll be happy to make them during the panel discussion, but we need to move on to the next speaker at the moment. Thank you.